When an infertile couple applies to a hospital for the evaluation of infertility, there are some tests to be done to do a search for the cause of infertility. It usually starts, or mainly starts, with the sperm analysis because it's cheap, simple, and can be done at any time during the month. Sperm analysis searches for 4 problems in the semen sample. First, semen volume, which should be more than 2, less than 4 milliliters. The other one, number of sperm, which should be at least 15 million per milliliter. The other one is the morphology, the shape of the sperm. It should be alright. And the other one is the motility, movement of sperm. At least 30% of sperm should be moving forward. So these 2 parameters are evaluated by the embryologist or the technician in the lab to make sure of the sperm quality. If it's okay, then we go ahead and do some other tests in women. Usually we start with the hysterosalpingogram, which shows the tubal patency, demonstrates tubal patency as well as uterine cavity. Because whatever we plan, we need to have a normal uterine cavity. If there is any fibroid or polyp located inside the uterus, it can be fixed, it can be removed by hysteroscopy. Both tubes can be visualized by injecting some soluble liquid inside. It takes a few minutes and might be a little painful, but it's not as painful as you should be scared of. And after having this test, we'll be able to get some information on your tubes and your cavity. Then the other test comes. Anti-Mullerian hormone may be performed on any day of the cycle. Together with antral follicle count, we have valuable data on your ovarian activity, and we can arrange your medication, the amount of medication to use, ovulation induction, and we can talk to you regarding pregnancy rate through IVF. The other hormone to be tested is TSH, thyroid stimulating hormone, which is usually done early in the morning and gives clue about thyroid function. If it is high, which might be the indication of hypothyroidism, then other thyroid tests, namely T3 and T4, are assessed. The other hormone is prolactin, which is important because hyperprolactinemia might cause infertility by disturbing ovulation, the implantation. FSH is another hormone to test for the ovarian activity and function. If they are normal, and if you have some other problems like hirsutism, excessive hair growth, other androgen hormones are assessed prior to starting any treatment. Pelvic sonogram, which is important in the evaluation of the structure of the uterus, tubes, and especially ovaries. If there is any uterine serous fibroid or cystic structures in the ovaries, they can be detected by vaginal sonogram. Again, it's a very painless procedure. It takes 5 to 10 minutes to visualize the uterus and the ovaries. Vaginal sonogram also gives a very important information on the ovarian activity. We are able to assess or count antral follicles located in both ovaries. It should be at least 5 to say that this woman has normal ovarian activity or reasonable adequate ovarian function to respond to ovulation induction agents. So AMH and antral follicle count are the most important 2 tests to assess ovarian function. There are 2 other tests to evaluate uterine cavity. The first one is saline hysterosonogram, which is the injection of saline inside the uterine cavity and check the uterine cavity by vaginal sonogram. It also gives valuable information on the uterine structure. The last test is the hysteroscopy. The hysteroscopy can be done in the office or we do it under mild sedation because it might be painful to do hysteroscopy if you do it for the purpose of removal of fibroids or polyps. But hysteroscopy is a gold standard to evaluate the uterine cavity, and in case of any abnormality such as polyp or submucous fibroid, these can be fixed or removed during the hysteroscopy procedure. We IVF Turkey team are willing to be with you in the treatment of infertility. Good luck!